name is Paige, and today I'll be your nurse practitioner student. I'm going to perform a full head-to-toe assessment on you. I would wash my hands, and I have all of my supplies ready. This is a 30-year-old male who appears healthy and in no apparent distress. I would like to begin the head-to-toe assessment with a cranial nerve assessment. I'm going to assess all 12 of your cranial nerves. Cranial nerve 1 is the olfactory nerve, and to test this, I'm going to have you occlude one nostril and blow out. And I'd like to do the same thing with the other side. And cranial nerve 1 is intact. For cranial nerve 2, we would normally use a Snelling chart for a visual acuity test, but for spatial reasons, we'll defer this exam. For cranial nerves 3, 4, and 6, I'm going to have shine a light into your eye. And first I'm checking for a direct response, and then looking for a consensual response. Okay, and the pupils are round, reactive, and responsive to light. I'm going to have you follow my finger, but do not move your head. Okay, and then follow it. Perfect. Convergence is noted. And I'm going to have you cover one eye and look at my finger and look behind me back at the wall. Okay, and with your other eye, do the same thing. Look at my finger and then look at the back wall. Okay, dilation is noted with accommodation. Cranial nerves 3, 4, and 6 are all intact. For cranial nerve 5, I'm going to have you tell me if what you feel is the same on both sides.
Yes. Yes. Yes.
And cranial nerve 5 is intact. For cranial nerve 7, I'd like you to raise your eyebrows and smile and puff out your cheeks. Cranial nerve 7 is also intact. For cranial nerve 8, I'm going to walk slightly behind you and do what we call a whisper test. I'm going to say 2 words and you just tell me what you hear. Boat.
Boat.
Cat.
Cat.
Okay. 16.
16.
7.
7.
Okay. And cranial nerve 8 is intact. For cranial nerves 9, 10, and 12, I'm going to have you open your mouth and stick out your tongue and say ah. Okay, you can close your mouth. And I'm going to put my hand on the side of your cheek here, just press against me with your tongue. And same thing on the other side. Okay, cranial nerves 9, 10, and 12 are all intact. For cranial nerve 11, I'm going to have you raise your shoulders up against my hands. Okay, cranial nerve 11 is also intact. All 12 cranial nerves are intact. We'll move on to our full head-to-toe assessment, beginning with the head and the face. So I'd wash my hands and then we would begin this part of the assessment. I'm basically assessing the head for any deformities, any swelling, any pain, any open wounds. None are noted in this exam. I'm also going to palpate the face, the maxillary sinuses, and the frontal sinuses for any signs of swelling or pain or tenderness. I'm also going to listen to the temporal arteries for any signs of bruise. And no bruise are noted. I'm going to look at the eyes now. And I'm looking for a corneal light reflex, and there is a red reflex noted. And the corneal light red reflex is also noted. The cornea, the iris, and the conjunctiva appear healthy. No redness is noted, no drainage. They are clearly visible and intact. No detachments are noted. The optic disc, the vessels, and the retina are all visible and intact. I also need to perform a test for your hearing. And just tell me if you can feel this on both sides.
Yes.
All right, I'm going to now touch your ears. I'm looking for any deformities. The skin is pink, warm, and dry. I'm going to take a look inside the ear. There is no redness noted. The ear bones are clearly visible. There is a minimal amount of serum and no drainage. No redness noted. The ear bones are clearly visible. A minimal amount of cerumen and no drainage is noted. Okay, and I'm taking a look at the nose now. The nose is symmetrical. I'm going to look inside the nose just to make sure the internal structures appear normal. I do not see any internal masses. There is no drainage or blood. And the lips appear pink and moist. If you'll open your mouth for me, I'm just going to look inside here. Okay, I'm looking at the tonsils, which appear 2+. If I had gloves, I would palpate the oral mucosa inside the mouth. I will not for this exam. There is no redness in the back of the throat. I did not notice any loose teeth, any bleeding in the gums. The gums appear healthy, and there is a swallow observed. And we will go from the mouth to the neck now. I'm going to look for any enlarged lymph nodes, starting with the submental, moving to the submandibular, tonsillar, parotid, periauricular, posterior auricular, occipital, superficial cervical, deep cervical, posterior cervical, and supraclavicular. None of the lymph nodes are palpable. There is no tenderness. There is no swelling. The trachea is midline. I'm going to palpate the carotid pulse. And the carotid pulse is strong and regular, 3+ noted. And moving from the neck, we will also go ahead and notice any, check the skin turgor for any tinting, which there is none, it is brisk. The skin overall is warm, pink, and dry. I'm going to go ahead and have you stand. I'm going to move the chair around so we can do the chest and lung assessment. Have a seat there. Overall, the chest, or the back of the chest, the posterior side appears pink, warm, and dry. I don't see any wounds or deformities. There doesn't appear to be any signs of trauma to the back. I'm going to percuss. And tympani is heard throughout. I'm going to go ahead and listen to the lung sounds. The respirations are equal and unlabored and symmetrical. And take a deep breath. Deep breath. And deep breath. Deep breath. Deep breath. And deep breath. Okay. The lung sounds are clear bilaterally. No wheezing, dyspnea noted. I'm going to measure with my hands for the AP diameter. And the AP diameter is half of the transverse. And I will also listen to the lateral side. Twice on the right, or the left. Take a deep breath. Okay. And 3 times on the right. Take a deep breath. Okay, and the lateral lung sounds are clear. No signs of wheezing, no dyspnea noted. I'm also going to check for any CVA tenderness and excursion. So sit upright for me with your arms by your side and then take a deep breath. Okay, good excursion as noted. And if you'll stand for me, I'm going to turn this chair around. And we'll listen to the front. And overall, the front anterior side of the chest appears pink, warm, and dry. I'm feeling for any deformities or masses. None are noted. I'm going to listen to your lung sounds on the front. breath. Deep breath. Okay. And the lung sounds are clear bilaterally, no wheezing or bronchial are noted. You're going to also listen to your heart sounds. I'm going to start with the PMI. So how we measure that is we're going to find our sternal notch, our angle of Louis, and the mid-clavicular line. We'll move down 5 intercostal spaces from this left mid-clavicular line. Okay, after listening to for the appropriate amount of time, we would determine that his rate is regular and strong at 65. We'll listen to all the other heart sounds as well, starting with the aortic area. How we find that, we find the sternal notch and the angle of Louis, and we'll do the right mid-clavicular line going down to the second intercostal space. And with the bell. Okay, and to find the pulmonic, we'll do the sternal notch, angle of Louis, mid-clavicular line on the left side, going down to the second intercostal space. And with the bell. And we'll move down 1 intercostal space to the third intercostal space, which will be Erb's point. And with the bell. We'll move down to the 4th intercostal space, which is the tricuspid. And finally, we'll move down to the mitral, which is the 5th intercostal space, mid-clavicular line. And with the bell. All right, thank you for letting me listen to your heart and lung sounds. We're going to have you move to the table now, and I'll have you lie on your back for the abdominal exam. Alright, I'm going to take a look at eye level just to see how the abdomen appears lying flat. It looks flat and symmetrical. I don't notice any hernias or open wounds on the chest. Everything is pink, warm, and dry. The umbilicus is fully circumscribed. I'm going to have you lift your head up just a little bit. And no grimacing is noted. You can put your head back down. No grimacing is noted when he raises his head. And we're going to start with listening to all 4 quadrants for vowel sounds. And vowel sounds are heard in all 4 quadrants. We'll then also listen for bruits in the aortic, renal, iliac, and femoral. And then the same on the other side, aortic, renal, iliac, and femoral. And no bruits are noted. I will begin by lightly palpating the abdomen now in all 4 quadrants. I'm looking for any masses or tenderness. No masses or tenderness are noted. I'm going to deeply palpate now. And again, we're looking for any masses or tenderness. And upon deep palpation, there is no tenderness and no mass found. We will also palpate the liver and spleen. I'll begin with the liver on the right side. basically going under and having the patient take a deep breath. Take a deep breath. And pushing in. I do not feel any, no organomegaly is felt. And the same for the spleen. Go ahead and take a deep breath. And no organomegaly is felt. All right, you can go ahead and have a seat back in the chair here. We're going to do your upper extremities and then your lower extremities. I'm going to begin by looking at your hands. I'm looking at the fingers, I'm looking at the fingernails. No cyanosis, no clubbing is noted. There is a brisk capillary refill. The hands appear clean. I don't see any wounds or lesions. There is no swelling. I'm feeling up the arms. No pain, no tenderness, no deformities. I'm going to check the radial pulses. And the radial pulses are strong and regular, 2+. Now I'm going to check the brachial arteries. And the brachial arteries are strong and regular, 2+. And if you could grasp my hands, okay, and then flex your wrists, and bring your elbows up. And then push against me, and then put your arms straight up, and bring them to the side, and then forward. Okay. And then I would like you to perform an exercise on your lap here. Just turn your hands over as fast as you can. Okay, and rapid alternating movements are intact. Okay, you can, there. The skin is pink, warm, and dry. He has range of motion intact with adduction and abduction, flexion, and extension noted. The muscle tone is strong. I'm going to check your reflexes now. Starting with the tricep reflex. And 2+ tricep reflexes noted. And a 2+ tricep reflex is noted. We're going to do the bicep reflex. And a 2+ bicep reflex is noted. And a 2+ bicep reflex is noted. Now for the brachioradial reflex. And a 2+ brachioradial reflex is noted. And a 2+ radial reflex is noted. Okay, for the lower extremity assessment, I'll begin with the feet. I'm taking a look at the toenails again. No fungus is present. There is good cap refill. The skin is intact. I don't notice any swelling at all. I don't feel any crepitus in the knees. I'm assessing the quadriceps and the hamstrings. Can you push your feet out toward me? I don't hear any popping noise. Can you flex your ankles for me and then push against me? And then push down on me. Okay, good range of motion, good extension and flexion are noted. The muscle tone is strong. I'm going to go ahead and test your patella reflexes. And a 3+ patella reflex is noted. And 3+ patella reflex is noted. We'll do the Achilles. A 2+ Achilles reflex is noted. 2+ Achilles reflex is noted. The last reflex is the Babinski reflex. And that is negative and negative. I'm going to have you lie on the table just so I can assess your range of motion in your hips and your legs. And I'm going to bring your knee up to your chest. And I'm going to bring it out to the side. No popping is heard, no tenderness is noted. Great. And then if you could, with your right heel, move along your left shin. And left heel against your right shin. Okay, I'm going to check your pulses now. We'll start with the femoral pulse. Usually there's not clothes, but for this exam we'll leave the clothes on. And the femoral pulse is strong and regular. I'm going to listen. and the femoral pulse is strong and regular bilaterally. Now I'm going to feel for the posterior tibialis pulses. And the posterior tibialis pulses are strong and regular, 2+, and the dorsalis pedis pulses. And the dorsalis pedis pulses are both strong and regular, 2+ bilaterally. Okay, I'm going to have you stand for our last few exams. And if you could just walk toward me. All right, and I'll have you walk back to the wall on your toes. And come toward me on your heels. And then heel to toe. Okay, and then come right to about here, and I'm going to have you face the wall, and then just bend to touch your toes. All right, and I'm assessing the spine. The spine is straight. You can go ahead and stand. The gait was steady, no weakness noted. His posture is straight. If you could bend to your right and then to your left, and then slightly forward, and then slightly backward. Okay. Good range of motion noted in the upper extremities. No weakness noted. And one last test for you. I'm just going to have you stand just like you are and close your eyes. And the Romberg test is negative.